So today we are joined by Kathleen Floud, a recent graduate from UT Health San Antonio's uh, entry to the profession master's program. She is recently credentialed as a registered respiratory therapist and works at Duke University Health Systems in North Carolina. Thanks for joining us today for our first coffee talk session.
Well, good morning, and thank you so much. I'm happy to be here.
So, I only know a handful of people who their dream was to become a respiratory therapist. Most people find respiratory in a different way, and those few people I know had a respiratory parent. So I love hearing about how you found the profession. So what got you interested in being an RT?
Well, this is actually my second profession. This isn't my first. I actually started out in education. I was in education for about 3 years, but just something was missing. I just didn't feel as fulfilled as I thought I should. So my husband actually was accepted at UTESCA into the DPT program, into the Doctorate of Physical Therapy program. And so we moved to San Antonio, and I took the opportunity to really figure out what I wanted, and I knew it was something in healthcare. I did a lot of research, came across respiratory therapy. It was the first time I'd ever heard of it, actually, as a profession. Spoke with some respiratory therapists about what a day in the life is really like. Did a lot of research, asked a lot of questions, did some soul searching, applied to the program, loved it instantly, and I still love what I do. And I suppose the appeal was, for me, it was the perfect balance between the patient care and the focus on patient care with the technical aspects of the practice and medicine and pathophysiology. So for me, it was the perfect balance and the perfect challenge, and I love it.
No, that's great. I was recently talking to a prospective RT student. Shout out to Charlie. And he's concerned that he's a little bit older as a student and it's a different profession. So for those people that are in that, situation where they are kind of established in what they're doing, but maybe not feeling fulfilled, you suggest just go for the gusto?
I would. I was in my later 20s when I went into the program. And I have met respiratory therapists now at Duke who are in their 30s and 40s, and this is their second or third career. And they had reasons to count the obstacles as a reason not to go into respiratory or to change careers later in life. But they're grateful that they did. They love it. It has paid off for them, and in the end, they enjoy coming to work, and they're glad that they did it.
No, I mean, I have various degrees. Prior to being a respiratory therapist, I was in the film video industry. So I think that, every so often you do need to reinvent yourself or reinvigorate yourself. I know I continually do advanced education, and I have never left RT while doing it, but the advanced education in other fields such as instructional design and getting my doctorate degree in organizational behavior and leadership for health sciences has really just added to my profession. So I can teach more, I can bring in things from other industries that really can help grow and promote our profession as a whole.
Absolutely. And I think in a way it can be an advantage coming from different backgrounds and having different life experiences and different skill sets when you come into the field and as you progress through the field. And as you know, with respiratory, once you're in the field, there are all kinds of avenues to continue to develop yourself. There are different patient populations, there are different concentrations, there are different avenues. You can go into management, you can go into education, you can go into sales. So I think it's a very, very interesting field, but it's also a very dynamic field. So I think it's an advantage. So yes, I do think it's an advantage, even if you're starting what you feel is a little later in life. I think there's a lot of good that comes from that. I happen to use a lot of the skills that I developed as a teacher. I use every day when I care for my patients, and it's been a huge advantage, come to find out. But I also think if anyone is worried about getting kind of shoehorned as a respiratory therapist and not having growth and not having options and development potential once they're in the field, I don't think that's a reality.
Well, and that's where I'm going to pitch my other podcast. I do have an audio podcast. It's like on iTunes and Spotify and like the regular ones. And that's called The Vent Room. And I really focus on the other roles respiratory therapists can fall into. I've interviewed respiratory therapists in sales, respiratory therapists who are clinical specialists, those that are working in research and those types of things, because there are a lot of opportunities for respiratory therapists that people don't think of. I know a respiratory therapist who's a case manager for an insurance company.
Oh, wow.
Yeah, exactly. So
Wow.
there's a lot of opportunities, and sometimes you do need to make your own, but at the other point, you need to look to see where those are. A respiratory therapist can get credentialed in case management because you have to be working a little bit as a case manager to be credentialed as one, but getting in the right organization that doesn't look at that terminal degree as, oh, they're a respiratory therapist and they're not an RN, so they can't be a case manager. There's pulmonary navigators and things like that. So I think there's a lot of opportunities that students themselves, when they're getting into respiratory, I'm going to say, yes, most of respiratory therapists work at the bedside. They're in the ICUs, and that's where we're known for. And until COVID, really, a lot of people didn't even know we were there.
True. And now they're grateful that we're there.
Exactly. So I know I'm pretty active on social media, and I see some repeat questions from like people interested in respiratory. And I know many people are so apprehensive about math, and they worry about their math skills and the skills that they would need to be successful. How bad was math while in respiratory school?
Let me be honest, I am not the most mathematically gifted individual, so I can sincerely say the math was not something that held me back from succeeding through the program or in school at any point. My honest opinion is it's pretty basic mathematics. You don't need to be gifted in calculus or statistics or anything like that for the program. There are some fundamental equations and formulas and kind of some norms that you'll need to memorize and keep with you, but it's addition, it's subtraction, it's multiplication. It's nothing particularly daunting. So fortunately, I don't think math by itself would be any kind of a hindrance to anyone who's interested in going through any kind of respiratory program. It's very manageable.
Great. And it's been a long time since I was in respiratory school. I mean, it's over a decade and a half ago. And I remember that it was challenging. There were those happy times, those stressful times.
Yes.
There were late nights studying. What tips do you have for students to be successful during their career? And especially now that a lot of students are having to deal with that Zoom room, that Zoom classroom.
Yes. And I got a small taste of the Zoom room classroom experience. I was towards the very end of my program when all of that really kicked in and started to become more of a regular experience. But very broadly, I would say the more organized you are, the better off you will be. It really is about understanding your day. I survived school by my planner, and I literally planned my day down to, this is the amount of time I spend in class, this is the amount of time dedicated to lab, this is the amount of time that I'm going to spend studying for this class tonight, this class tonight, this class tonight. And our professors did an excellent job of being very transparent about what the norm was going to be, what the expectations were, what the time commitments were going to be, and then projects and deadlines. So I mapped everything out, and I always worked ahead. I would always recommend work ahead. Don't save something for the last moment. It sounds cliche, but it's especially true with respiratory programs because the classes tend to be up front, and then the clinical experience tends to kind of be towards the latter half. So if you are looking at a program that tends to front load all of the classes, then you'll need to make sure you're very diligently planning, sticking to things, and working ahead as much as possible. I kind of had the motto, work ahead to stay on track. And for me as well, it was about taking things one day at a time and preparing for the next day and the next day and the next day. So I might have my planner with everything planned out kind of for the month or for the semester in terms of the major projects or major exams, but I focused on every day and I picked one thing to really get better at every single day. I would literally say just plan, be diligent, prioritize, and protect your time as well. Really be protective of your time, be honest about what you can commit to and what you can't commit to. Some of my classmates had commitments outside of the classroom. They had families, they had other obligations, they had jobs. So I would say just be mindful of that and commit yourself, but don't get overcommitted and don't lose sight of the goal. And then for me as well, I would also say that having a strong support system makes a world of difference as well.
I think you hit on a couple things. For me, what you're calling in your planner, I call it theming my week.
Yeah.
Right. That's the term that I use. And basically, between this and this, as a professor, we're juggling different things. Between this time and this time, it's going to be answering emails. For me, Mondays are like my calendar's blocked on Mondays because that's the day that I'm grading and getting feedback to all students. So any Monday commitments, it's just not available. So later on, at the end of the week is where I'm meeting with prospective students because I'm the online director for the degree advancement program. So I'm talking to RTs who are interested in advancing their careers to bachelor's or master's with us at UT Health in the DAP program. So it's the same thing, but I think also that support system, being honest with your family and saying, it's crunch time for the next this semester, but you also have to decompress, right? You can't be all school all the time, and it's not healthy. So making sure that in that plan, you're adding that recreation, that decompress time, that time with kids or family or whatever's important to you, even just reading a recreational
book instead of a have to read for school textbook. Yes. And my husband and I were going to school at the same time, which on the outside might seem like an ideal setup, but we didn't have the same schedules. We didn't necessarily have the same clinical rotation sites. Sometimes we were in different cities for extended periods of time. So having that support system and having someone who understood why you were having late nights and why sometimes you had to, go to lab and stay a little bit longer and all of these other things was very beneficial. But you're right, we both made sure that every once in a while we had to get away from the books, as it were, and we would go for hikes and just get outside, even if it was just for an hour or for 30 minutes or half a day on a weekend. That's what kept us going, was that support system and having those occasional breaks and being able to celebrate when things go well. And I think that's important as well, because when times are hard, it sometimes gets easy to get stuck in that mental place. So I say, yes, celebrate the success, take those breaks, have something where you can step away from the program and step away from school and the stress and have it for yourself. I think all of that together is what leads to the success through the program.
I agree. So I know as a professor, I've seen a theme in classes that are difficult for students who are starting out in RT. Mm-hmm. For you, which courses were the most difficult? And did you apply any additional study strategies for those specific courses?
Yes and yes. and I'm blushing a little bit as I'm saying this. I'm sorry, Professor Wetstein, if you're watching this. Anatomy and physiology was difficult for me, and mechanical ventilation was difficult in the beginning for me. Pharmacy was difficult as well, just because it's so much information in one class, so you had to be very on top of it. Generally speaking, for those classes, what I found is, yes, I could spend and I did spend a lot of time with the book and the materials. I did, but what actually helped me to really cement it was to teach others. That was part of my teaching background, is, see one, do one, teach one, right? Or I do, we do, you do. Kind of combinations. And I think having a smaller group of people with whom you could all go over things, you could talk through everything, you would literally take turns like teaching to others, having others teach to you, that reinforcement of concepts when you have to teach it to somebody else, when you have to draw it for someone else, when you have to explain it in your own words to someone else. And for me, doing that over and over and over again really, really helped me to succeed. It made the difference. And I think that's a little bit easier, especially for mechanical ventilation, right? Because you have, or had, but you have labs, you have equipment, you have concepts you can physically put your hands on and experiment with. You have all kinds of tutorial videos. You can draw, you can really articulate things in a number of different ways. Same with pharmacology, having to pretend to teach a patient and involve patient education, kind of that role play with one another about, here are the drugs, here's the side effects, here's how it works, here's what you can expect. All of those kind of study strategies, which maybe sounds a little extra, but it really made a difference in reinforcing those concepts. And I did much better in those classes once I started doing that.
And I think also, like you highlighted, working with other people in study groups. And I think really some of the strategies for a successful study group is making sure that it's not too big, right?
Has to be small, has to be.
And I think it's one of those things, because I've been talking to different students at different locations. And one of the challenges they have is, like, they'll get into a large study group, or they'll go to a study group and they're at a different point. So I think that kind of forming your study group early, this way you guys are working together on the same thing. So, you're on this class and you're working on this item versus somebody else in a study group who's wanting to focus on something else.
Yes.
So getting a cohesive group together where you can make a plan together and say, you know what, that theming that study group of, hey, we're going to do pharmacology on Tuesdays, and that teach one, do one is very important. Because if you can successfully explain it to somebody else properly and they understand, you know what you're talking about.
Exactly. And you hit the nail right on the head. It needs to be small. I kept mine to no more than 3 or 4 people, including myself. So my groups were small, and definitely having people who have the same goals as you, who want the same things from the course as you. For example, with the group that I studied with pretty regularly, we would already have read the chapter together, like on our own, before we came together to reinforce it. And then, like you said, Tuesdays, pharmacology, Wednesdays, another class, Friday, maybe another class. So it was a combination of really spending the time on my own, but then to reinforce it, coming together with that small group.
So a little switching gears, for clinicals, that's where you get to apply all that theory.
Yes.
You learn all this stuff in the classroom, and clinicals is really where you get a lot of aha moments, or those things that are a little confusing. Everything, the puzzle pieces start together and you're starting to see the big picture. Many times students are excited. They're scared about going to clinical, especially, like, even if you've did acute care clinicals, now you're going to ICU and you're going to be dealing with super sick patients on ventilators and things like that. What tips do you have for students to be successful when they're at their clinical sites?
Oh, so glad you asked me this question. And let me just say that I was very nervous when I went into clinicals, and kind of for every clinical, because you go into a different facility and you go into a different patient population, and it's a different department, right? So it's a little different every time. And I was always a little nervous to start. And I think if you're nervous, it's a good thing, because it means you're taking it seriously, and you really want to come prepared and to do the right thing. So I would say tips for starting clinicals and for going through the process. I think the best thing you can do, honestly, is to put your best foot forward. Ask questions, volunteer, get involved. If there's some experience that comes up, even if you don't feel like you're really prepared for it, just remember you're with a clinical preceptor who's not going to let you fail. So absolutely get involved, ask questions. If there's anything that you want from it, ask your preceptor. And depending on your preceptor, they might be okay with you if their department allows. They might be okay with you going with someone else to go see this procedure or go do this part of patient care. I would do everything you can to make the most of it. Be hands-on, volunteer, ask questions, and I would also be very respectful. I would also, as you get more comfortable and as you get a little bit more of autonomy with certain facilities, understand that you're a student, but you're also part of the team. You're being integrated as part of the team, even though you're under someone else. So I would say always ask if you can assist others as well, if you have the time and the opportunity. Be fearless, be respectful, be hands-on, do everything you can to get the most out of your clinical experience, because that is the time you have before you're on your own and it's your license, and now it's all you.
No, I think you highlighted some great points. Like I always tell students, they're on a job interview the moment they're on the school's clinical schedule.
Yes.
Right?
Yes.
People are observing if you're on time, if you're calling out and not showing up, how interested you are in learning, what you do with your downtime. Because sometimes, I mean,
Yeah.
right now it's COVID time and it's probably crazy everywhere,
Yes.
and things like that. But there are times where, summertime where I used to work was a little bit less stressful. There wasn't, it wasn't winter, there wasn't the flu. So we would see what students would do. And really, I'm going to say that people were hired based off our observations, because when I was a clinical person, I would say, hey, I had this student, I'm going to call out Seth Hall. He did the travel episode of the Vent Room. He was a student with us. And when he was a student, when he was done with his rotations, there was not only me, but several people that said, you know what, we want him on our team. We want you to make sure he interviews here and joins us.
Right.
So that's very possible. I know. Oh, go ahead.
Oh, no. I'm so sorry. But I was just I was trying to reinforce that you hit the nail on the head. It's what you do when you think no one's looking. It's how you act when you think you have downtime, and you absolutely. In fact, I think that's actually when people watch you a little bit more closely sometimes. So for me, I was not on my phone when I was at clinic. I was not on my phone. I was always trying to introduce myself to other therapists, offer, is there anything I can get you? Is there anything I can do to help you? Can I put your equipment together? Can I go get you something? Can I send this specimen off for you via the tube station? Is there anything I can do? And yes, there's always the aspect of this is a potential job offer, and this is also a reflection of you as an individual, not to mention the program. But that's also the kind of person I was, and that's the kind of person I am. It went over very, very well. And I'm not going to say that I was a perfect fit for every facility necessarily, but my experiences were always positive, and I always had doors open, because that's how I was, even when there was no one standing over me watching me. And
You
that makes the
just,
biggest difference.
yes. And I think you just made a great point. As much as it's a job interview that the student is being interviewed, it is the department being interviewed by that student.
Absolutely.
You
Yeah.
know, because not everybody is a right fit for different jobs. I remember, though it's been a long time since I've graduated respiratory school, I remember all of my first job interviews. And it happened to be that I graduated originally with my associates of respiratory at Illinois Central College and in Peoria, Illinois. And I was looking to get out of that area. I had moved there for a family reason. The family reason that I was there had been resolved. So I was looking to expand, and I ended up getting several job interviews in Washington, D.C. It was like I sent my resume, and I had 4 job interviews in the Washington, D.C. area. And I went out there, and I remember specifically interviewing at a very well-known hospital. And it just, as much as the name had prestige, that was not where I wanted to work when I was meeting like the interview and walking around. And I was expecting it to be, this grandiose kind of place. And we just didn't click. That me and the interviewer didn't click. But every other job interview I had in DC, everything clicked. I got the offers. I was having to make decisions, which were very hard. Where do I want to start my respiratory career? And I picked some really great places, and I made friends with people. I like to when I would interview, I'd make connections so that I had other people within the community of RT. And the RT world is small.
It is.
It's
deceptively small.
it is, because I happen to know, like, my friend Seth has done a travel assignment at Duke University Hospital. I know Ira, who is one of the medical directors over the PICU. So it's a very small community, and sometimes you don't want to burn your bridges at one place. And especially in a city, a lot of those people went to school together, they communicate. And it's like anything with like a review. No one ever raves and reviews, this place was amazing, right? They review when they didn't have a good experience. And sometimes, it's like, hey, did you have the student?
It's the negatives that tend to stick, right? And I will say that it's okay as a student to go to these facilities and realize, I'm not sure I'm a great fit for this place. And I think that's okay. You're not going to be a perfect fit for every department, every facility, every kind of patient population. I think it's about discovering, and I think part of that journey as a student is discovering, well, what do I value? What do I want when I'm out of school and I'm on my own? What kind of a facility do I want? What's important to me within a department? What do I really love? And yes, don't burn your bridges. Even if you go through your rotation and you've already internally decided, I don't want to apply here when I graduate, which is okay, you still need to act like you're applying for the job, if that makes sense.
Right. And even if it's a facility you're not interested in working in, you can't tune out at clinical.
Correct, because that will follow you
exactly.
to other places. Yes.
And I've seen situations where somebody maybe might have tuned out at clinical because they weren't interested in a job at that facility. Right. And that preceptor, who is like a leader in respiratory care, because they're taking on and teaching students, they were the therapist there, but now they're the department head at the hospital that you want to work at. And they remember the experience they had with you as a student.
And all it takes is a phone call or an email. That's all it takes. Absolutely. And that's the way that I thought of it as well. And it's a great point to make, because you never know who knows who where, or who's working another job somewhere else. So absolutely, it's putting your best foot forward no matter what. And I've been on both sides. I certainly at some point went through an experience like, valuable experience, not the place for me, but I'm not going to let them know that. I'm going to act like nothing's changed and I'm still planning on applying for the job. Not to be deceptive, but just I didn't want to burn bridges, and that's not the reputation that I wanted for myself.
No, and I totally agree. And I think that that's something that as a student in clinical, you are getting exposed to different things. If you're having issues with a clinical site, because sometimes there might be issues,
Right.
reach out to your DCE, which is your director of clinical education.
Yes.
Also know, like, you might have been at clinical site X, right?
Right.
And you were there for a while, and you basically, you kind of earned your chops, right? You can go do some ventilator checks by yourself. You can suction. You've earned some autonomy as a student, but you're still under somebody else's license. So, like,
Yes.
if they're letting you do that without them being present,
That's a privilege. Yeah.
well, it's a privilege, but at the same time, if you did make a mistake, it's on the person who you're with,
Yes.
because you are working under their license.
Right. Correct.
So, those types of things. But when you go to a new facility, it doesn't matter that you were basically autonomous at place X. You're going to have to,
Start
I
over.
always, exactly, you start all over. It's just like a new job. People are wanting to know, okay, do they understand the concepts? Do they understand what they've learned? Are they where they're supposed to be at the level that they're supposed to be? Because I know many years ago, I was working with some students and they were about to graduate from a school, and it was the first time the school did clinicals with us. And at the end of the day, I'm kind of like, they're supposed to be graduating in when? Because I didn't feel that they were up to snuff. And then we were working with that particular school to say, hey, was it this student? Because
Right.
here's the thing, whether you're the straight A student, I've seen straight A students that were book smart and they were not as effective in clinical. I've seen that passing student at a C that was a clinical star. So really, to me, it doesn't matter GPAs matter, right? But
It's not everything.
it's not everything. And most times jobs are not asking, what was your GPA in school? They're wanting to know that you passed the board exam and that you're licensed in the state
Yes.
and that you can legally work.
Yes.
And it's
Those
an
are the
interpersonal,
restrictions. Yeah.
right. It's an interpersonal job. You're dealing with people, and you're dealing with people on their best and worst days.
Yes.
Like I had said, I was a new grad. I relocated to a different area because of a job offer. In your process, looking for work in an area you didn't go to RT school, how did that kind of fall into play? Because obviously, like, I guess you and your husband were graduating maybe around the same time. So you both had decided, this is where you were going to go. But how was it, because I think a lot of us, we get our first job from our clinical sites.
Most people do. And as an aside, if things had not worked out at Duke, I had an opportunity at one of my clinical sites. If life had gone a different way, but I digress. It is a bit of a risk when you're moving to an area you're really not familiar with and you're moving for the job. And you're right. In my case, it was my husband and I both applying at Duke. And honestly, what I would recommend, if at all humanly possible, and I know COVID has changed some of these things for some of these facilities, but Duke still actually invited us to come out and meet them and come see the facility and come spend a day or two in the area in Durham. And they literally went out of their way to recommend everything. What do you like to eat? What do you like to do? Here's where to stay. Here's where to, they spent an hour and a half with us which is crazy for Duke. like looking back on it now, I'm like, that was a lot of time that they spent with us during a very busy period. But my department my department took the both of us, gave us the tour, bought us lunch, took us to Starbucks, the whole shebang. They really went out of their way to say, listen, whether you go with us or not, we just want you to know that if you come here, you're coming to a family. We're going to look out for you. We're going to help you. If you have any questions at all about what there is to do here or where to live or anything else, just ask. So that definitely contributed to to the experience, but not everyone has that. And I would say just be very, it's always a risk when you're moving somewhere you've never been before. It's always a risk. because you just don't know everything. It's not the same as having lived there and been there for weeks as a student and everything else. But I would say that do your research as much as you can. Ask the facility if they can give you a tour, if you can take a tour, if you can come meet them in person, if you can look at their equipment, if you can really kind of get an idea for it. If you can do that, do that. I would encourage people, don't be afraid to take a risk. And frankly, it's not permanent. You know, if it doesn't work out, it doesn't work out. And you can always go somewhere else. It's not permanent. It's not a lifelong commitment.
Right.
You know, but it very much paid off in our case, and we love it here. But we did do a lot of research, and yes, we crunched numbers and we made sure we could practically move here, afford to live here, everything else, of course. But no, we are part of a family here. Absolutely.
No, and I think you highlighted a different thing. Like I said, I had moved from Illinois to Washington, D.C. The only time I was in Washington, D.C. was for the interviews. I'm a risk taker. I moved to the Middle East and did respiratory care there for several years, and then moved to Texas, sight unseen, really never been to Texas, but joined the UT Health San Antonio faculty. And I've never regretted the risk. I moved to New York City when I was 18 years old for my film career, right? So I've never regretted taking the risk. And it is scary, and it is much easier if you have other people. But when I moved to New York City at 18 by myself, I was by myself. When I moved to Washington, D.C., I was by myself. And then I made friends, and I had, you know, my Friendsgiving, and work does become a family because you end up gaining so much from them, and they do become your friends inside of work and outside of work, and you celebrate birthdays and kids being born and all those different things. Yeah. So and then just, you know, make sure you're prepared. You have that little savings and things like that, and research the area, you know.
Yes. And to be very practical for just a moment, if you have an offer on the table and you know what your offer is, make sure it's a feasible offer. There are some areas of the country where cost of living is much higher compared to others, and just make sure that realistically it's an offer you can afford to take, if that makes sense.
No.
You know, there's some practicality involved in it as well. But I'm like you. When I was younger, I moved 1,200 miles away from home, lived on my own. So I guess I'm a risk taker. And the way that I see it is, it's perfectly fine to stay within your comfort zone, but I did not want to, and I knew what I wanted, and I knew what I didn't want. I happened to find it at Duke. It could have been somewhere else. But that was something I was willing to take a chance on and take a risk and move for. And my husband too. So it worked out. But
no, I was offered a job in Hawaii once, right? And I was like, ooh, wow. Hawaii, right? and the offer, you know, on the surface, like when you heard the numbers, you're like, all right, that's not too bad. But then when I sat down and crunched the numbers, you know, the cost of living in Hawaii, because it's off the mainland. I mean, exactly. And when I started crunching the numbers and looking, and there's websites that you can go to where you can say, if I make this much in San Antonio and I'm moving to Washington, D.C., how much money you need to be working or earning in that other city to have that same kind of lifestyle. Yeah. Right. Yeah. So I was doing that, and I'm like, man, I really want to live in Hawaii, but I'm going to be going back to like eating ramen noodles to do it. And I'm in my career way beyond the ramen noodle, you know, career level. Yeah. And I ended up saying no to that. But, you know, it's that, you know, living in Hawaii sounds sexy.
Oh, it sounds great. But then you look at the other side of it and you're like, oh, wait a minute. Wait. Right. And so I would always, advise that as well. And frankly, even if you're thinking of San Antonio to Austin, or if you're looking at even something in state or within a reasonable drive, even, same thing, I would recommend that for everybody. Just the number itself might sound good, but really go out to those websites or crunch the numbers yourself if you've done it before, and realistically what to expect when you crunch the numbers and what to account for. Crunch the numbers, and it's not all about money. And I am saying that right now. I did not go chase a paycheck. I do okay. We're comfortable. We're not living the lifestyle of the rich and famous by any means, but we're comfortable. So it's not all about money, but you need to be able to have more than ramen noodles every night.
Right. Well, you have to be able to survive, and I mean, not even just survive, right? Because if you're working paycheck to paycheck and there's that struggle, one of the great things about respiratory care, especially if you're working at the bedside, typically your schedule's 3 shifts. Right. People work extra shifts. Most of my career, I always had my full-time and a per diem job where I picked up hours. And if I needed some extra money, I just worked a little more. So it balanced out, because sometimes that unexpected car breaking down and that it's like, oh, I need new tires.
Yes.
You don't budget for those as well as we should. And then therefore it's like, you know what? Okay, I need a couple extra shifts to make the difference of that expense that I wasn't expecting.
Right. And, I think for better or for worse right now, given it's the winter season, which tends to be busier anyway, coupled with COVID, there's all kinds of opportunities for overtime pay right now, or PRN, or some combination therein. And I work 4 days a week, not because I have to, but come to find out, I get very, very, very bored at home with only 3 days a week. So my husband's like, yeah, go work a 4th. So I do that. And yes, it helps to have a little extra coming in case the tires or anything else, or now you have a car payment, or now you have a this, or now you have a that, or now whatever comes up. But absolutely, it's the blessing of respiratory. You can always work more if you want to. If you need to, you can always work more. Always. That's the nice part.
Exactly. So I know that you said that you had a really good experience interviewing at Duke, and they toured you around, and you had this opportunity to connect with them, and they're like, hey, just if you come here, you are joining a family. What were the interviews like for the actual job versus that get to know you soft interview? Because that's a soft interview when they're walking you around and having coffee.
Right. And that came after the hard interview, to be really honest with you. The real interview was much more intimidating than that. And I think there's always an element of nerves because you really want the job, and, you try to prepare. Quick aside, by the way, I would recommend to everybody, especially if you're coming out of school, know what you're interviewing for and do some research, even if it's basics. Go over your fundamentals of mechanical ventilation. Go over your fundamentals of the path of blood flow through the heart. Go over your basic fundamentals for the key concepts that you should know. And if you're going for neonatal or pediatric, make sure you review things like the jet, the oscillator, things like that. Those questions will come up at some point. So make sure you're prepared to talk about some shop questions, and make sure you know your fundamentals pretty strongly. But with that being said, it was over Zoom because of COVID. So essentially what happened is I was interviewed by 2 people. It was supposed to be 5. COVID happened, called away some of the team leads and the managers, so it wound up being with 2 people. It was meant to be with 5. And they told me up front, we have 10 questions for you. You're going to have 30 minutes. So realistically, I might only get 2 or 3 questions in. And this is a grading scale, and we're grading your responses. And no, we're not going to tell you the score, but basically, if you score well enough, we pass it on to managers, and you will go through the process. start. So no, so not stressful at all, to know that up front. And then and I would say that was the hard one. That was and it wasn't soft questions like tell us about yourself. It was fundamentals of respiratory. It was why are you an asset to our team, above everybody else? Why should we pick you? Kind of a routine. But it was a lot of, okay, this is the situation. What do you do? This is the situation. What do you do? And some of it was clinical. It was testing clinical knowledge. And some of it was multidisciplinary interactions as well. They were big on that. And now that I work at Duke, I understand why they're big on that.
So just for reference, that's called behavioral interviewing.
Yes.
So for anybody who is listening or watching and you're wanting to learn more about that is behavioral interviewing. I'm going to say group interviews are very common across the board in respiratory care because you are joining a team and a family,
right.
And they're kind of vetting you for that and saying, hey, there's 10 questions and we're going to knock them out and you're being graded. That's pretty typical. You're going to have people interviewing you that have pieces of paper in front of them and they're taking notes. And the reason being is that puts everybody applying on a level playing field. It's not that you're going to get a question that's different, easier, harder than someone else. You're going to be getting presented the same questions and you're being graded against people of your caliber. Like, the way I interview a student and the responses I expect for them when I was in a hiring position is going to be different than somebody who's been in the field for 10 years that has worked in a high acuity facility. What I would expect from a community hospital therapist that didn't work at a level 1 trauma center and they're wanting now to work at a level 1 trauma center, I know that it's going to be different. So realizing that is, it's pretty common.
Yeah. And I would say just come prepared. Try not to let the nerves get to you. You're going to be nervous, especially if you really want the job. You're going to be very nervous. And it went well. Thank God. It went well. And after that, it was the kind of softer interviews, but it was definitely the hard ones up front, for sure.
And then, are you currently working day shift or night shift?
So I'm day shift. I am.
All right. So you're a new grad that's going into day shift. I know I saw recently a question on social media about, how long people are on nights. So you actually came into a day shift position. So it does happen. So I think that you really just have to look. There's a lot of people on nights that don't want to move to days. That's
true too. We definitely have a night shift that's very dedicated to staying on nights. They love the night shift. If you're starting nights and you really want to get to days, of course, there's always the matter of you have to sometimes wait. Well, it depends on the facility, right? But it takes time to move to day shift, but there is always the potential to start on days. I considered myself very lucky to start on days. I still think I'm very lucky that I got to start on days. And part of that, actually most of that, came from the interview. They wanted me on days and they knew that I have aspirations to grow and to go into specialties, and day shift they believed would really reinforce that potential for me, maybe a little faster than on nights. So I was blessed to start days, but it does happen. And I've met other therapists, not just at Duke, but when I was a student, who started days. So you're excited, you landed that job, Yay. Woohoo. Yeah. Now it's time to start. In my experience, that first few days are kind of uneventful with hospital orientation, mandatory training. Did you have that same experience? It was brief. It was only 2 days of that. And then it was, you're in the middle of it all. So, and most of that was online. Because of COVID, it used to be, right, you would report to the facility, you'd spend all day going through the hospital orientation, kind of the welcome to this facility. HR would do a little bit of a spiel as well. But for us, that was only like a couple of days. And then it was, you really are starting. This is for real. Here's your patient load. Here's your mentor, but you're doing it. You're doing the work. So I would say that that little kind of soft start was very quick. It was very quick.
And then everybody's hospital orientation is different. You had your very quick hospital orientation. Now you're going to your department orientation. How did that work? You know, I guess they assigned you a mentor.
So let me back up just a little bit. Duke's orientation process is quite extensive because of the size of the hospital. We're over 1,000 beds, and we have something like 10 ICUs, so it's quite a bit. So it was a 90-day orientation process total, so 3 months total. Everyone's is a little bit different depending on their background, but since I was a new hire and new start right out of school, I spent four weeks on the floors. So I would have a different person sometimes every day who was my mentor. I did not follow their schedule. I can't really tell you why. That's just not the way that it's done. After that, it was pulmonary step down units for a couple of weeks, and then it was rapid fire through all the ICUs. Just every ICU was like one week, except for MICU, which was, MICU is the medical ICU, and that was for 2 weeks, largely because there's such a diversity of care that the medical ICU typically always gets 2 weeks. That's your heliox, that's your oscillators, that's your everything. It's everything in the medical ICU. So that's a little bit longer. And it was, here are your days. You might have someone who's a little bit different every single day for your mentor. Here are all the things you need to get checked off on by the end of the week or the end of the shift. And here's your case. Here's your load. Go to work.
Now, your overall transition from student to therapist during the COVID time, how has it been? I mean, I know it's crazy in general, like when you're first transitioning, but anything like, did you feel prepared? Or if somebody's kind of scared in the sense of, you know, I feel like there's always that imposter syndrome. You get that, you earn the education, you do the education, you earn the degree, you get the credential, but you don't feel like, you know, you're there yet.
Yeah, you don't feel ready. I mean, I think most of us don't entirely feel ready for everything that we can encounter, especially on day one. But with COVID, was I prepared? Well, in all fairness, like I said, you know, this kind of really hit hard with respect to my program at the very end of my program. So the program did not have an opportunity to prepare us for COVID. We didn't even really know what it would mean to manage COVID back then. Even just a few months ago, it just wasn't really clear. And I don't know how programs have adjusted to that. But no, I wasn't prepared to treat COVID patients. And all of a sudden, being on site, being on the job, being the respiratory therapist with a license and being entrusted to treat them, I had a lot of questions. I still have questions. I still have questions about how to care for them, and you know, I've moved past the PPE portion of that. I've got that down. But sometimes protocols change and protocols keep evolving and practices keep evolving, and things that we used to do now we don't do anymore, or things that we didn't do now we're doing, all of those things. So I think that's been kind of the biggest stress, is trying to stay on top of all of the developments as they come out. And Duke's not immune. We are changing protocols and practices, and we are changing the things that we do and don't do with COVID patients. And for the record, we do everything now. We do everything now with COVID.
Yeah. And I think that really, I mean, now there's research on COVID, there's papers being published. When it first came out, there was nothing. And we've all, across the world, healthcare was flying by the seat of their pants.
Yes.
But I think really the foundational knowledge that you get in school, it doesn't matter. Like, this is the pandemic that's happening now. Hopefully in the future, we don't see another one, but I never expected this in my lifetime. So now I'm kind of like, when's this is going to happen again? But we hope it doesn't. But I think that really, as long as you have the foundations and you're understanding, how the lungs work, when you're facing a new disease, you're able to translate that information. And I've been doing this for a really long time. And even now, when I'm doing clinical work, I will run across a syndrome or something that I have never heard of.
Right.
And I'm going to have to do research. Now, what's great is, guess what? You have Google and online academic journals where you can get information that, 20 years ago, about 20, 30 years ago, practitioners didn't have all this amazing information in their pockets.
True. And don't forget the people that you're working with too, who have been doing this since January, February, and they've learned quite a few things along the way as well. And I always, let me phrase it this way. I can't give you like official numbers from Duke, but anecdotally, we tend to get the sickest of the sick. So you will occasionally, maybe, I know I have several COVID patients, and it's not unusual because I started off right in the ICUs, like right out of orientation, and I am predominantly in the ICUs. You will have cases where COVID patients just don't respond to what you do. They don't respond to FiO2. They don't respond to PEEP. They don't respond to this mode of ventilation. They don't respond to that. They don't respond to INO. They don't respond to ECMO. They don't respond to... don't beat yourself up, because realize we're all in the same boat, and realize that even when you have a license and you're practicing, you're not alone. And I think when you're looking for a job and you're looking for a good fit as a student, that's something you really want to evaluate for yourself is, do you see these respiratory therapists in this department being one that will support you and be patient with you and help build you? And fortunately for me, I have wound up in a place that's exactly that. And, we're all trying to figure out COVID together, and we're all adjusting to changes and protocols and procedures. And so there's a camaraderie for that. But yes, if you are strong in your fundamentals of respiratory disease and mechanical ventilation and anatomy and physiology, if you've got a pretty firm understanding of the basics, you will be prepared to work as a respiratory therapist out of school. The only thing you're really missing at that point is ongoing education and experience, which you will get with time. So I would say, yes, COVID is scary and you may not entirely feel prepared. I don't think anyone really feels completely prepared when they go to their first day of being an RT ever. But again, you are not alone. Your fundamentals. I would keep some, if not most, of your notes and your resources from school. And, the professors have always made it clear to me that if I ever have a question, if I can't find the answer, if something's really not working, I can call them, which is great too. So there will be resources and there will be people, and don't worry about feeling overwhelmed. You are not alone. You're not.
Well, Kathleen, I appreciate your time today and doing this little coffee talk with me. And I feel like it's going to be very beneficial to future RT students, current RT students, and those looking to join the field. For those watching or listening, check out rtstudentcoffeetalk.com. Join the newsletter to know when there's new episodes being released. Ask questions. If you have anything or any topics you're interested in, reach out to me. Basically, my goal with this is to answer any student-related topics or career topics, have guests, people to talk to, interviews, speakers that can answer the questions you don't necessarily want to ask other people. Also, check out the Vent Room audio podcast on iTunes, Spotify, and other major podcast providers for more RT-related items. And I also started a Facebook community, RT Student Coffee Talk, where you can join me and others as they start their RT journey.
Yeah. Thank you so much for having me. Thank you.
You're welcome. Thanks.